Good day all. As part of my series of talks on health and healthcare, this talk will look at how private healthcare works in the US. The US has never had the comprehensive state-run healthcare insurance that Canada has. US healthcare has always been more decentralized, with more room for private enterprise. However, the massive expansion in healthcare after World War II was primarily led and financed by the state in the US, as it was throughout the Western world. The US federal government set up state-run insurance for the neediest, Medicaid for the poor, and Medicare for the elderly and disabled. The government also passed laws which stated that private healthcare insurance could only be offered by non-profit organizations like Blue Cross and Blue Shield. These organizations, in turn, would only provide insurance to non-profit healthcare organizations. This meant that most US hospitals and clinics were run by boards of trustees on a non-profit basis. Also, most general practitioner doctors, especially from the early 1970s on, organized themselves into health maintenance organizations, or HMOs, which were non-profit physician group practices where doctors worked for a salary. Only specialists remained independent business persons, as in Canada. So, as recently as the 80s, despite certain organizational differences, the US healthcare system was in practice not that different from the Canadian healthcare system. They both consisted primarily of non-profit organizations run by doctors under state supervision. But since then, things have changed dramatically in the US. Privatization transformed non-profit healthcare into for-profit healthcare in the space of a few short years in the 80s and 90s. How was this possible? It was possible because 1981 saw the election of President Ronald Reagan. Reagan was a very right-wing president whose number one priority was increasing the profits of American corporations. To this end, he introduced a policy of deregulation, which consisted of scrapping the government regulations that had been built up since World War II to put limits on corporations, and instead just allowing corporations to do whatever they wanted. This policy has resulted in American corporations doing great harm to the environment as well as to human health. As regards healthcare, Reagan scrapped the limitations on for-profit healthcare, and in particular, the limitations on for-profit healthcare insurance. And by 1989, when Reagan retired, he had abolished virtually all restraints on corporate acquisitions. In other words, big corporations were now free to buy up as many small businesses as they wanted. In the insurance industry, this led to the rise of a corporate oligopoly, which quickly took control of healthcare insurance, and through that, of healthcare in the US. Privatization of healthcare began, inevitably, in the corporate sector. The state got its healthcare insurance from non-profit organizations, but corporations insured with other corporations. As a result, workers' compensation became the largest area of healthcare covered by for-profit insurance. The only problem was that this private healthcare insurance was much more expensive than public healthcare insurance. For example, Chrysler Automotive Corporation did an internal study which concluded that private healthcare insurance and private healthcare was costing them $700 per car manufactured in the US, while at their state-insured Canadian plants, it only cost $223 per car. This is my first, but not my last, example of private healthcare costing about 3 times as much as public healthcare, which on average it does. In the 80s, American industrial corporations began demanding that private insurance companies find a new and cheaper way of providing healthcare insurance. This new way emerged in 1988 with the signing of the first Managed Care Arrangement, or MCA. This arrangement was a 3-year contract for a private insurance company to provide an industrial corporation with healthcare coverage at a guaranteed, locked-in, low rate. Soon, everyone was signing MCAs. This was good for industrial corporations, but it meant that insurance companies' income fell significantly. As their profits were squeezed, small companies had to consolidate into larger companies to survive. A wave of mergers and takeovers turned the US insurance industry into a classic corporate oligopoly, controlled by a relatively small number of large corporations. By 1994, the US still had many thousands of private insurance companies, but the top 100 health and life companies controlled nearly 90% of the industry's profits and assets. And in 1994, those profits were over $12 billion US, and those assets were about $2 trillion US. Income from healthcare insurance premiums alone was over $300 billion US. As soon as this corporate oligopoly was in place, it began to expand by buying up Blue Cross and Blue Shield companies all across the US and converting them from non-profit status to for-profit status. Then, these big corporations expanded outside insurance by buying up HMOs, consolidating them, and converting them to for-profit status. In 1984, only 18% of HMOs were for-profit. By 1997, over 75% were. And by 1994, the 10 largest HMOs reported combined liquid assets of $10.5 billion US. This corporate takeover of HMOs meant that in practice, doctors had lost control of their own practices and had acquired a new set of corporate bosses who had a whole new set of healthcare policies in mind. For-profit healthcare meant prioritizing profit over healthcare. For example, while HMOs were non-profit, they spent about 90% of their income on the health services they provided. Once they were privatized, this fell to only about 70%, despite steadily raising their prices. Corporations not only prioritized profit over healthcare, they also prioritized their big corporate customers at the expense of small businesses and individuals. While MCAs provided corporations with stable premium rates, healthcare premiums for small businesses and individuals skyrocketed. Some rates rose by up to 400% in a few years. As a result, more and more Americans simply could not afford healthcare insurance. Also, major cutbacks in funding to Medicaid and Medicare, begun by Reagan in the 80s, were continued in the 90s. This meant that by the early 90s, there were over 30 million Americans with no healthcare coverage. By the late 90s, it was over 40 million, and as of 2019, it had fallen back to about 30 million. In addition, it's been estimated that there are another 70 million who are underinsured or have inadequate healthcare insurance. The US is the only Western country that does not have some system of universal healthcare coverage and that allows millions of its citizens to go without healthcare. Having so many uninsured people has dragged down US health rates. A 2006 study by Harvard Medical School found that while insured Americans had about the same health as Canadians, uninsured Americans' health was much poorer, especially for chronic illnesses. Overall, compared to Canadians, Americans were, for example, 42% more likely to have diabetes, 32% more likely to have high blood pressure, and 12% more likely to have arthritis. Moreover, the sharp rise in the cost of healthcare has meant that increasingly in the US, illness means bankruptcy. The Harvard study also found that of the 1.5 million Americans who filed for bankruptcy in 2005, fully half did so because they developed medical problems which their insurance did not properly cover. When private corporations take over healthcare, they always do two things. First, as I was just saying, they raise prices. Second, to boost profits further, they also cut back on services. Managed care, which means privatized care, became a corporate code word for cutbacks. Deductibles were raised, expensive specialized treatments were removed from the standard benefits package, and co-payment fees were introduced. Co-payment, which in Canada is called extra billing and which is illegal, consists of additional and ever-growing fees which the insurance company simply refuses to cover and which the individual has to pay. From 1987 to 1993, hospital co-payment fees for managed care patients rose by over 450%. By 2018, the average US family paid about $20,000 a year for healthcare insurance and almost another $14,000 a year in deductibles and co-payments. Moreover, despite the private sector's claims to increase consumer choice compared to a government monopoly, the big insurance companies actually moved to drastically restrict consumer choice. Under managed care, insurance companies give employers an annual list of doctors and services covered under their plan. Patients can only go to those doctors and only for those services. Not only does this mean fewer services, it means that patients can only go to doctors employed by their insurance company. Those doctors have been instructed by their corporate bosses that their priority is to maximize corporate profits by providing the minimum amount of services that they can and getting the workers back to work as quickly as possible, whether that's good for their long-term health or not. This instruction was accompanied by a financial incentive. Instead of being paid according to how complex the work was, doctors were now paid a flat rate per patient. This gave them an incentive to spend as little time as possible with each patient so as to maximize patient volume and so maximize their incomes. So, under managed care, patients receive fewer services and shorter periods of care. Managed care also involves the privatization or outsourcing of hospital support services, such as laundry and catering. The problem is that, despite the private sector's claims to provide these services more cheaply than the public sector, they are in reality always more expensive. In 1995, private hospital support services in the US cost 24% more per day than public support services in Canada. Overall, in 1995, Canadian hospitals were 42% less expensive per patient discharged than US hospitals, even though the average length of patient stay in Canada was 48% longer. Putting those two figures together reveals that for-profit American hospitals cost almost 3 times as much per hour of patient stay as non-profit Canadian hospitals. Another example of private healthcare costing about 3 times what public healthcare does. An American study at the time concluded that the US would save over $7.5 billion US each year if it switched to the Canadian system. Managed care also involves raising profits by replacing skilled staff with cheaper, unskilled or semi-skilled staff wherever possible. In particular, registered nurses have often been replaced by minimally trained aides, while the few remaining registered nurses who run things may be forced to work 16-hour shifts. The inevitable result of this situation is that death and injury caused by nursing mistakes in hospitals has skyrocketed. In 1999, the US Institute of Medicine estimated that medical mistakes led to the deaths of between 44,000 and 98,000 patients each year. In the year 2000, the Chicago Tribune newspaper documented nearly 2,000 dead and 10,000 injured by nursing mistakes in the US since 1995. Despite these problems, corporate acquisitions continued through the 90s and 2000s. By 1998, 15% of the US's 5,200 hospitals had been bought by big corporations and converted to for-profit status. This acquisition was done by corporations like the Columbia Hospital Corporation of America, which was founded in 1987 by a small group of doctors and corporate investors and promptly began buying up hospitals and clinics. By 1997, it had bought up over 600 healthcare facilities and become the largest private healthcare organization in the world and one of the largest corporations in the world, with an income of over $25 billion US a year. By 2016, this income had grown to over $41 billion US, even though in 2003 it was found guilty of the biggest healthcare fraud in US history for submitting fraudulent workers' comp claims and had to pay over $2 billion US in fines. For-profit hospitals, like those owned by Columbia HCA, have raised their profits by raising their prices. This means that these hospitals have come to focus on providing services to high-income patients. Low-income patients are diverted to non-profit hospitals, which puts a growing strain on the non-profit sector. Private hospitals have become hospitals for the rich and consume more and more resources. By the year 2000, almost 75% of US healthcare services were being consumed by the richest 10% of the population. A two-tier healthcare system had come to the US. US private healthcare corporations claim to provide the best healthcare in the world. But this is at best a half-truth. As Canadian healthcare analyst Colleen Fuller put it, the US's privatized healthcare system, quote, offers the best care for the fewest number of people, and this is its greatest accomplishment. In other words, private healthcare provides the best healthcare in the world for the rich and the worst healthcare in the world for the rest. The swift privatization of healthcare in the 80s and 90s took most Americans by surprise. Since most of the organizational changes took place behind the closed doors of corporate boardrooms, most Americans had no idea what was happening until it was done. As soon as Americans understood the consequences of privatization, protests began to mount against it. By the mid-90s, opinion polls were showing that almost 90% of Americans were, quote, highly dissatisfied with their healthcare system, and that almost 2/3 would have preferred to switch to a Canadian-style state-run healthcare insurance. The polls also showed that most Americans, like most Canadians, believe that it is immoral to get rich off the misfortunes of the sick and disabled. In response to these protests, Presidents George Bush Sr. and Bill Clinton both put forward proposals for modest restraints on healthcare privatization. But neither of their proposals was implemented, partly because US insurance companies spent over $100 million in the early 90s on a propaganda campaign against them. Finally, in 2010, President Barack Obama enacted the Patient Protection and Affordable Care Act, known as Obamacare. This act eliminated some of the worst consumer rip-offs that private insurance companies were using and introduced new regulations, as well as increasing funding for Medicare, Medicaid, and the uninsured. Obamacare has helped to provide health care for the poorest segments of the US's population. However, ultimately, it's just giving more government money to private healthcare corporations, which means that over the long term, it's only making the problem worse. I shall conclude our look at the US with a brief international comparison. Up to the early 80s, American healthcare expenditure was similar to that of most other Western countries. But since then, privatization has sent the cost of US healthcare through the roof. By 1991, the US spent $662 billion on healthcare, already far more than any other country. In 1999, this spending passed $1 trillion. In 2005, it passed $2 trillion. In 2014, it passed $3 trillion. And in 2020, it passed $4 trillion. The US now spends over 1/3 of total world healthcare spending. It spends over $10,000 per person per year, which is double the average spending by all other Western countries. In 2018, it spent 17% of its national gross domestic product on healthcare, which again is about double the average of all other Western countries. Since, as I've said, private healthcare costs on average 3 times as much as public healthcare, I would expect this total to continue growing until the US as a country is spending not just twice, but 3 times as much per person on healthcare as most other Western countries. Yet, despite this massive expenditure, the World Health Organization ranks US healthcare as 37th in the world, which is nearly last among developed countries. Canada's partial privatization, which I shall examine in my next talk, has dropped its world ranking to 30th, while raising its spending to over $7,500 per person. France currently ranks first in the world, and Europe's stronger resistance to privatization has meant that its health services are now greatly superior to those in North America, particularly the US. That concludes what I have to say on private healthcare in the US. A transcript of this talk is available if you're interested. Good day.